And next here, the description, muscle relaxant. And here, basically, the muscle relaxant are contraindicated in clients with a severe liver, renal, or heart disease. And these medications are often metabolized in the liver or excreted from the kidney. Right? So let me read it. Skeletal muscle relaxants are contraindicated in the client with severe liver, renal, or heart disease. So if my liver does not metabolize, how it works? If the kidney does not work, how it expel out from the body? Or heart disease, we never give skeletal muscle relaxant. And these medications are often metabolized in liver or excreted from the kidney. So if NCLEX board tell us what are the organ name medication metabolized, answer is liver. What are the organ name medication expel out from the body, answer is the kidney. Skeletal muscle relaxant should not be taken with central nervous system depression such as barbiturate, opioid, alcohol, sedatives, hypnotics, or tricyclic antidepressant, or unless specifically prescribed. So what wrote? Skeletal muscle relaxant should not be taken with. So these two medications we do not prescribe together. What tools? Like skeletal muscle relaxant and the medication act in the central nervous system depressant. What it is? Like barbiturate, opioid, alcohol, sedatives, hypnotics, and tricyclic antidepressant. Let me give you an example. Tricyclic antidepressant like amitriptyline and baclofen not together. Amitriptyline and cyclobenzapine not together. This is good. Now let me go next. What are the common side effects or what are the common adverse effects of skeletal muscle relaxant? They can cause dizziness and they can cause hypotension, drowsiness, and muscle weakness. They can cause dry mouth or gastrointestinal upset, photosensitivity, and liver toxicity. My friend, side effect and adverse effect, it is not same. Side effect is expected, maybe or may not, but adverse effect is very bad or unfortunate patient have to face it. If patient has any hypersensitivities to particular drugs, like Stevens-Johnson syndrome, it is life-threatening. It is the adverse effect or drug hypersensitivities, adverse effect. But if you give Dyzapine and patient is sedative, this is the side effect. It is nothing bad, nothing abnormal or threatening for the life. So when you give the muscle relaxant to your patient, tell them you maybe feel dizziness, so don't go for the driving. Maybe you have a chance to develop blood pressure drop. So when you change the posture, you have to be concerned. Otherwise, you will be fall. Maybe this medication can cause drowsiness or muscle weakness. They can cause dry mouth like cholinergic drugs, and also gastrointestinal upset. Maybe patient complain about nausea, vomiting, or diarrhea, or photosensitivity, hypersensitive to the sunlight. Tell them if you go to the under sun, better to wear long sleeve and wear the sun protective lotion, wear the sunglasses, or liver toxicity. What else? And what are the intervention? Hmm? As a healthcare provider, it is important to know what we could do. So obtain the medical history. Medical history means if patient have any hypersensitivity reaction to particular muscle relaxant, we do not give it to them. Ask about the current medication being taken, monitor vital sign, and monitor central nervous system effect. And what next? Intervention. So determine the risks for injury. So if patient take the muscle relaxant, if they fall, it can cause injury. So just tell them or prevent the injuries are priorities. Monitor involved the joint and muscle for pain and mobilities. Because most of the musculoskeletal problem or disease, the joint loss free movement. So we have to check mobilities, monitor the kidney function test or renal function. Like we could check patient serum creatinine, or we could check the patient BUN, because this is the marker of the kidney function. Reinforce the instruction to the client to take medication with food to determine gastrointestinal upset. So if we go back, I can show you the medication can cause gastrointestinal upset as a side effect. But if you give with food, you can prevent gastrointestinal upset. So why not? Tell your patient it is good to take muscle relaxant with food and prevent your diarrhea, nausea, or vomiting. Reinforce instruction to the client to report side or adverse effect. Reinforce the instruction to the client to avoid alcohol and central nervous system depressant. Reinforce the instruction to the client to avoid activities require alertness, like you are going to deal with heavy machinery, machine to deal. So it is better to avoid, where you need the alertness. Monitor liver function test when the client is taking muscle relaxant because the hepatotoxicity can occur. So muscle relaxant can cause liver toxicity. So it is good to check the liver function test. So if you check the liver enzyme, it is in the normal range, means your liver is okay. You can give it, prescribe this. Now let me talk about some consideration about baclofen. So baclofen causes the central nervous system effect such as they can cause drowsiness, they can cause dizziness, they can cause weakness, they can cause fatigue, nausea, constipation, and urinary retention. So administer with, if you prescribed or if your patient need to take baclofen, we have to follow some precursor. What it is? We have to know my patient kidney is okay, liver is okay, or patient do not have any kind of seizure. That's it. Baclofen can admin by primary healthcare provider through the intrathecal infusion using an implantable pump or by directly intrathecal administration over 1 minute. So definitely you do not need to go to the specialized doctor who is the specialized in musculoskeletal system. No, the primary healthcare provider or nurse practitioner can prescribe baclofen. The client with an implantable pump is instructed to maintain medication refill appointment to prevent the pump from emptying or experiencing sudden withdrawal, the symptoms. What else? Other drugs we commonly use as a muscle relaxant is called chlorzoxazone. So if you prescribe these drugs, we monitor the client for hypersensitivity reaction like urticaria. It is a skin rash like redness or itching. It is the sign of hypersensitivity reaction to the skin or angioedema, swelling, right, in the lips. So it may cause malaise or may cause urine turn orange or red color. And chlorzoxazone can cause hepatitis, means inflammation of the hepatic cell, liver, or hepatic necrosis if you do not stop. Hepatitis lead to necrosis later on. Due to some unknown reason, the NCLEX board like to ask the question from cyclobenzapine. So cyclobenzapine is contraindicated to the client who have received monoamine oxide inhibitor, shortly called MAO, right? This is the psychiatric medication. So psychiatric medication, particular monoamine oxide inhibitor and cyclobenzapine never even never together. And also monoamine or cyclobenzapine within 14 days of initiation of cyclobenzapine therapy and in the client with a cardiac disorder, never give it to them. Some note, cyclobenzapine has significant anticholinergic effect. What is anticholinergic effect? They can cause retention of urine. They can cause dryness on the mouth or mucosa. Anticholinergics are called atropine-like because atropine is one of the member of anticholinergics. Effect and should used with some caution in the client with history of urinary retention, because anticholinergic can cause urinary retention. If my patient have a urinary stasis, you give them anticholinergics, problem will increase, but patient come to you to reduce the problem. Keep in mind, we are talking about the cyclobenzapine. It is the muscle relaxant, but my friend, the character of this, they are anticholinergic groups of drugs. I told you before, some medication have both effect, like Dyzapine can work muscle relaxant, but they have a anti-anxiety effect. They are tranquilizer. Cyclobenzapine, anticholinergics, but they have a muscle relaxant effect. So if your patient have a angle closure glaucoma or increase the intraocular pressure, so we have a blood pressure, everybody know, but we have a pressure in the eye, it is called intraocular pressure. If intraocular pressure is high, it is good not to give cyclobenzapine. If also we have a pressure in the brain, it is called intracranial pressure. Like patient has a meningitis, intracranial pressure increase. If patient has a glaucoma, intraocular pressure increase. If patient has a high blood pressure increase. Or if my patient diagnosed benign enlargement of prostate, we never give cyclobenzapine. Cyclobenzapine should be used only for short-term therapy, only for 2 to 3 weeks. Other most common drugs and flexible like Dendroline. So Dendroline has a skeletal muscle relaxant effect. Dendroline acts directly on skeletal muscle to relieve the septicity. Liver damage is the most serious adverse effect. Liver function should be monitored before initiation of the treatment or during the treatment. So if you prescribe Dendroline, it is good to check liver function first. Or if your patient already taken and continue the treatment, it is good to check the liver function during the treatment. Dendroline can cause gastrointestinal bleeding, urinary frequency, impotency, photosensitivity, skin rash, or muscle weakness. So again, I said reinforce what you tell your patient about Dendroline. So patient education. Reinforce the instruct to the client to wear protective cloth when they go under the sunlight because photosensitivity. Educate or instruct to the client to notify healthcare provider if rash or bloody or teary stool or yellow discoloration of the skin or eye color. So muscle relaxant, Dendroline we are talking here. So something is important I want to share with you, particularly about the Dendroline. Dendroline we use to treat the septicity. What is septicity? Muscle stiffness or tightness. Or Dendroline we use for muscle spasm, what is associated with spinal cord injury, stroke, multiple sclerosis, or cerebral palsy. But Dendroline, the NCLEX board, my friend, listen very carefully. NCLEX board asks a question from Dendroline, common question. Dendroline we use if anybody body temperature is so high. We know when we have a fever, we can use acetaminophen or ibuprofen from Walmart, whatever it is. Like a patient or a children have a high fever, no medication can work. That times Dendroline is there. So Dendroline is also used to prevent or treat a medical problem we called malignant hyperthermia. That is the question NCLEX board asks. In case of malignant hypertension, when acetaminophen not work, ibuprofen does not work, what do we use? We use Dendroline. Life-saving, right? And I mean, malignant hypothermia that may occur in some patients during the following surgery or anesthesia. Because of these drugs, anesthesia or surgical operation, we use anesthetic drugs can cause high body temperature. Malignant hypertension consists of a group of symptoms, including high fever, fast and irregular heartbeat, or breathing problem. But Dendroline is there. It can work. It helps. It saved the life. Another drug is called Dyzapine. What is nursing consideration? Dyzapine, muscle relaxant, right? But you already know this is a tranquilizer, psychotic, we use for anxiety. Very friendly drugs. Dyzapine act in central nervous system to suppress the septicity. Does not affect the skeletal muscle directly. Does not. So it is good, right? And sedation is a common side effect. And this sedation is sweet, very sweet. Patient enjoy it. So now another drugs we called methocarbamol. So the parental form is contraindicated in the client with renal impairment. The parental form can cause hypotension, bradycardia, anaphylaxis reaction, or seizure, especially when medication is given too rapidly. So what you do? We never give too rapidly, right? We give slowly. Then you can prevent suddenly blood pressure drop, or you can prevent bradycardia, you can prevent involuntary movement of muscle or seizure. We could monitor the site for extravasation, which can result in thrombophlebitis, means vein inflamed, thrombus formation, phlebitis, or tissue sloughing. And it may cause the urine turn brown, black, or green. So if patients do not know and they see suddenly the black urine is green color, oh my God, right? They will be afraid. They will be get anxiety. They will be worried. So you as a healthcare provider, you tell them you are taking the drugs. Because of the drugs, your urine color is green. Don't be panic. The client is informed to notify healthcare provider if difficulty of vision, blur of vision. But basically, you know what? The patient do not say, I have a difficulty of vision. They said, I last night when I was watching TV, I did not see well. Last night when I was reading the book, I can't. So it means difficulty of vision, blur of vision. Sometimes it causes nasal congestion, urticaria, or skin rash. So what else? Other two drugs, which is called metaxalone, can cause liver damage, or also these groups of drugs has a significant anticholinergic effect and should be used with some caution in the client with history of urinary retention, angle closure glaucoma, or increased intraocular pressure. Safety is a primary concern when the client is taking a skeletal muscle relaxant because this medication causes drowsiness. We are healthcare provider. What is the first priority? First priority, safety. Safety for whom? For my patient, because we love our profession. So NCLEX board, if asked any question, and if you get the safeties there, always it is the answer. So safety is the primary concern. Safety is the priorities. Like we are talking about the infection control. Why we follow the precursor? Because of safety. Skeletal muscle relaxant. If you give your patient take it and they fall and broken legs and fall and injury to the head and trauma. So it is, you give medication, but medication causes another problem, right? So you have to tell your patient when you need to change the posture, be careful. You lying down, better to sit on the edge of the bed for a minute, then take some help and stand up. And because these groups of drugs can cause sedation, these groups of drugs can cause dizziness, can cause drowsiness. Now, let me talk about anti-gout medication. So the gout, we know what it is. The gout basically we discuss in musculoskeletal system. Right? So anti-gout. So if anybody is diagnosed by the gout, we give them anti-gout medication. Sometimes somebody calls this gouty arthritis. Basically, gout, a form of arthritis characterized by severe pain, redness. You see the picture? Redness, tenderness in the joint. Particularly, gout start from the big toes. And pain and inflammation occur when too much acid crystallizes in the joint. So what is crystal acid? How they come in body? Because of the protein. So anti-gout medication, basically we use for allopurinol, we use colchicine, we use probenecid, or sulfonyl pyrazone reduce uric acid production and increase the uric acid excretion to prevent and relieve the gout or manage the hyperuricemia. Let me recap it. As I told you, gout characterized by severe pain, redness, and tenderness in the joint. But why it is occur? Why pain? Why inflammation? Inflammation occurs when too much uric acid crystal or deposit in the joint. So you have to give me something to reduce the production of uric acid or increase the uric acid excretion from the body and relieve the pain, relieve the inflammation, and relieve the gout, or to manage hyperuricemia. So when uric acid is too much in the blood, we call uremia. When uric acid too much in the urine, we call hyperuriuria. So now here, non-steroidal anti-inflammatory drugs, particularly shortly called NSAID. So NSAID are used for their anti-inflammatory effect to relieve the pain during an acute gouty attack. So in the first line, we see allopurinol here, allopurinol and colchicine. Both are anti-gout medication. But which one when we use? Right? So allopurinol or colchicine we use is depends upon is it acute problem or it is chronic problem, right? So again, I said it depends upon the duration. Particularly, allopurinol can be started during an acute attack. How you remember? Allopurinol start by alphabet A, and acute attack started by A, acute. A for apple, A for allopurinol, A for acute, A for attack. Right? So don't forget it. But if our patient has a chronic problem, chronic gout problem, we use the colchicine. Okay. Now go for the steroid has a role. The glucocorticoid may be prescribed to reduce the inflammation and during the acute attack. So steroid has the same role. NSAID has a property as an anti-inflammatory effect. Anti-gout medication should be used some caution in the client with gastrointestinal, renal, cardiac, and hepatic disease problem.